Shawn Tassone, America's Holistic Gynecologist, and I wanted to talk to you today about something that I'm really passionate about, and that's women's hormones. But there's different ways that women can get hormones. You can do creams, you can do sublingual pills, and I want to talk today about one that I absolutely cannot stand, and that's called hormone pellets. So I'd like to talk to you today about the pitfalls of pellets. The first reason that I hate pellets is that they're just too damned expensive. There's absolutely no need for you to spend that kind of money. You're talking $300 to $400 every 3 to 4 months, whereas a prescription for a compounded hormone is about $45 a month. So in most cases, pellets are about 3 times as expensive as just using a hormone cream, and the creams are much better. The second reason that I hate hormones is because your levels go way too high. In most women that I've seen that are following up with me on pellets because they feel like garbage, their testosterone levels are way too high. They're into the range of their male counterparts. Now, that may sound fun and exciting to have a testosterone level that high, but there's 2 things that happen when your hormones go too high, especially testosterone. Testosterone side effects, you can get clitoromegaly and you can get deepening of your voice, and those 2 things are permanent. They never go back to the way they were before, so you really want to be careful with your hormone levels. The third reason I hate pellets is because it's a procedure. It's a minor surgical procedure done in the office. They take this very big needle, it's a trocar, and they have to dig a pocket into your butt cheek. Sounds like a fun Friday. And they insert the pellets in there. Then they put a stitch in it usually to close it up. Now that's done every 3 months to you. Bruising, infection, bleeding, all kinds of possibilities. So I don't like it because it's a surgical procedure. The fourth reason I hate pellets is because they don't come out. You put them in, they don't come out. You don't like the side effects, they're not coming out. You don't like the headaches, the irregularity, the bleeding, the water retention, the weight gain that it could be causing, you aren't getting them out for about 3 to 4 months, so you're stuck with the side effects. The fifth reason I don't like them, playing off of number 4, they're in for 3 months. So any sort of side effects you might have, they're in there for 3 months. So get used to the side effects because you're gonna have them for a while. The sixth reason I don't like pellets is because they absorb at irregular rates, meaning instead of getting a steady state of absorption like most of these places will tell you, it's completely false. What's gonna happen is you're gonna get a rise in your hormone levels, and then you're gonna get a crash in your hormone levels, and you're gonna keep doing this every 3 months. So you're gonna have a sawtooth pattern. So for that first month, you feel like Wonder Woman, you're on cloud 9 because your levels are so freaking high to the point where you could have side effects, that when they start to drop, you start to feel that again, and then women are complaining that they feel like they gotta get their hormones, but they come back in to see me and their hormones are actually too high. And that's because you were super high to begin with and now you're dropping. So you have 1 month of feeling like Wonder Woman and then 2 months of feeling like garbage. I don't like them because they don't absorb at regular rates and they give you an unsteady state of hormone levels. The seventh reason I don't like hormones, big dollar sign. And the reason that there's a big dollar sign is because if you're paying lots of money, they're collecting lots of money. This is a money-making procedure for clinics. Look at them now. Plastic surgeons are doing them, urologists are doing them, hormone PAs and nurse practitioners are doing them. And most of these people, plastic surgeons, have absolutely no care about women's hormones, but what they care about is the big green. And you're making them lots of money. This is a procedure, it makes money. They're sending somebody to a course for 2 days, and then this person is now a hormone expert in their office and they're putting in hormone pellets. They don't know the ins and outs of hormonal manipulation. It can be dangerous, I wouldn't recommend it, but that's who's out there doing it. The 8th reason kind of plays off the 7th reason. Who's putting them in? You have a lot of people out there putting in hormone pellets that know absolutely nothing about hormones. Now they might know something about a surgical procedure in the office, they might be perfectly adept at doing that, but they don't know what they're doing with hormones. So why would you go see someone that went to a weekend course about bioidentical hormones or that said they know what they're doing when they really don't have a grasp of the blood work, how to interpret the blood work, what to do with the blood work? They're not even interpreting it, they're sending it off and having somebody else look at it. So know who's putting them in. The 9th reason that I don't like hormones is because when you try to set up an account with one of these companies that I won't mention, they make you join a club. So you have to pay them about $1,000 a month to be in this club in order to prescribe their pellets. Then you have to buy the pellets from them in order to use the name. So the money is going all the way back to the company, obviously. And so if a physician or an MA or a PA or a nurse practitioner is putting these in, they're paying money up front to get the hormones, to join the club. So of course they're gonna be biased and wanna put them in everybody. Unfortunately, I just don't believe that everybody should get them. I don't think that everybody should get pellets. I don't think anybody should get pellets, to be perfectly honest, but everybody at these clinics gets put on pellets, and that's because, again, it's following the money. Last but not least, the last reason that I don't like pellets is because, playing off of the last two, it's a protocol. So let's say you get your labs drawn at these facilities, they send them into a computer, the company then tells them what dose of a pellet to put you on. There's no art involved, there's no patient care involved, you're just a number. You're literally a number on a computer screen, and they're doing the dosing based on just your numbers. They're not necessarily talking to you and asking you about how you feel, they're just putting these things in based on what this computer program is telling them. So not only do you not have someone that's an expert putting this surgical procedure and these pellets in your butt, you have somebody that's putting these in just based on some random protocol. So there you have it. 10 reasons why I don't like hormone pellets. I think you can decide for yourselves. This is Shawn Tassone, America's Holistic Gynecologist, and I hope to see you next time. Bye.